My name is Laurie Ross, and I'm an associate professor in the Dalla Lana School of Public Health at the University of Toronto and a scientist at the Centre for Addiction and Mental Health. I was approached by Cheryl Dobinson, a member of the community who works as an educator, an activist, and writer, and she brought to my attention the numbers that were just starting to come out at that time, showing really significant mental health disparities for the bi community. And so that's how I initially got involved in this work. We started out doing a qualitative study to try to understand what factors might account for the mental health disparities that we were seeing in the epidemiological data that were just coming out. So what we did was we spoke to 55 bisexual people from across the province of Ontario and asked them to tell us what they felt were the factors that were most important to their mental health, both positive and negative. And so we analyzed those data and developed a model of determinants of mental health for bisexual people, which we then later got a second grant from the Canadian Institutes for Health Research to try to essentially test our model and look at a much larger sample of bisexual people from across Ontario and try to determine which of these factors were indeed associated with the mental health outcomes we were interested in. I think for me the most important finding from our research is that bisexual people experience discrimination in unique and important ways. So although bisexual people do experience homophobia, just like their gay and lesbian counterparts, there are also specific experiences of discrimination that have to do with being bisexual specifically. And because bisexual people experience this discrimination not only from heterosexual communities, but also within gay and lesbian communities, that added burden of discrimination perhaps puts bisexual people at additional risk for mental health problems. I think I would want the friends, partners, other important people in bisexual people's lives to most appreciate that bisexuality is something to be embraced and celebrated. That bisexuality isn't a problem in any way, that society makes bisexuality a problem, but that it's not actually. It's a really wonderful thing. It creates opportunities and possibilities and lots of joy in people's lives. And so when your bisexual loved ones come out to you as bisexual, that's something to celebrate and to share their happiness in, not something that you need to worry about or see as a problem for them. I think the most important thing that service providers can do is to educate themselves about bisexuality, because service providers have been exposed to all the same social messages that the rest of us have. And so what our participants have told us is that many service providers also believe that bisexuality is a problem, that it's a transition stage, that it can't be a healthy, stable sexual identity. And obviously those kinds of messages are not helpful to bisexual patients and clients. So if service providers can educate themselves, can check in about their own biases about bisexuality, that will have an enormous impact on the quality of care they can deliver to their clients. I think there's a lot more research that needs to be done in the area of bisexual health. I think we're only just starting to appreciate that bisexual people are our own community with needs and experiences that are distinct of those from gay and lesbian people. So really, I feel that we've just started to scratch the surface, and there's a lot more that we need to understand about health and wellness and mental health and well-being for bisexual people.